Prostate Cancer 4+3, what you must know before making any decision. The big mistake most men make. Most men, just like you, get hit with this news and immediately think, I need surgery right now. But hold on, meet John. He's 52, healthy, active, and last year he was diagnosed with 4+3. His doctor said, let's operate now. But John, he took a deep breath and did something different, and it changed everything. John learned something shocking. Treatment isn't just about surgery, it's about knowing all your options. In fact, studies show that in certain cases, lifestyle changes can slow or even stop cancer progression. But no one talks about that, do they? Here's what you need to do first before considering surgery. The game-changing factor. Most doctors skip this. Most men hear prostate cancer 4+3 and immediately think, I need surgery, I need radiation, I need to act fast. But what if I told you that might not be true? Because here's what doctors don't always emphasize enough. Your lifestyle, stress levels, and even what you eat can have just as much impact as medical treatment. But before we get into that, I want you to stick with me until the end of this video, because in the final section, I'm going to break down exactly what foods, sleep habits, and daily routines can actually slow or even halt prostate cancer progression. You won't want to miss this. Wait, what? How could something as simple as food and stress management change cancer progression? Think of your body like a fire. Cancer is the flame. Medical treatments, they act like fire extinguishers, sometimes necessary, but not always the best first move. But what's the fuel keeping that fire burning? Inflammation, hormones, stress. And if you don't control those, then no matter what treatment you throw at it, the fire keeps coming back. Studies have shown that men who change their diet, reduce stress, and improve sleep can slow or even halt prostate cancer progression. Some cases even show tumor shrinkage without aggressive treatment. But why isn't this the first thing doctors tell you? Simple. Because most of modern medicine is focused on treating disease, not preventing it. So before you make any life-changing decisions, ask yourself this: am I doing everything I can to take control? Because in the next section, I'm going to show you exactly what steps you can take, starting today. What can you do right now? Immediate action steps. Okay, now let's talk about you. If you're facing a 4+3 diagnosis, here's what I need you to do. Step 1, get a second opinion. Always. Step 2, start tracking your diet and stress levels today. Studies show stress hormones can make this worse. Step 3, watch my next video on the best prostate diet. Trust me, this could change your game. If you take one thing from this video, remember this: the ultimate mindset shift. If there's one thing I want you to take away from this video, it's this: you are not powerless. A 4+3 diagnosis might feel like a death sentence, but it's not. It's a wake-up call, and how you respond right now could define your future. Look, I've seen men just like you, terrified, overwhelmed, convinced their fate was sealed. But guess what? Some of those men are now thriving. Why? Because they made a choice to take control instead of giving up. Think of your health like a ship at sea. Cancer might be a storm, but you are still the captain. You decide whether to let the waves toss you around or to steer through it with purpose. And here's the good news. You have options. You have time to make informed decisions, and you have more power over your health than you've ever been told. Lifestyle choices to slow or halt progression. Facing a Gleason 4+3 prostate cancer diagnosis can be overwhelming. However, emerging research suggests that certain lifestyle modifications encompassing diet, physical activity, and sleep may play a pivotal role in managing the disease's progression. Dietary choices. Adopting a plant-based diet rich in fruits, vegetables, whole grains, and legumes has been associated with a reduced risk of aggressive prostate cancer. A study published in the American Journal of Clinical Nutrition followed over 47,000 men for 28 years and found that those who primarily consumed plant-based diets had a significantly lower risk of developing aggressive prostate cancer. Key dietary recommendations: increase fruit and vegetable intake. Aim for at least 5 servings daily. These foods are rich in vitamins, minerals, and antioxidants that support overall health. Choose healthy fats. Limit saturated fats found in red and processed meats. Instead, incorporate sources of healthy fats like avocados, nuts, and olive oil. Incorporate omega-3 fatty acids. Regular consumption of fish rich in omega-3s, such as salmon and mackerel, may help reduce prostate cancer risk. Limit dairy consumption. Some studies suggest a potential link between high dairy intake and increased prostate cancer risk. Moderation is advisable. Physical activity. Regular exercise is beneficial for overall health and may specifically impact prostate cancer progression. Research indicates that men engaging in regular physical activity have a lower risk of developing advanced prostate cancer. Exercise recommendations. Aerobic activities. Engage in activities like walking, jogging, or swimming for at least 150 minutes per week. Strength training. Incorporate resistance exercises at least 2 days a week to maintain muscle mass and overall strength. Sleep and stress management. Quality sleep and effective stress management are crucial components of a holistic approach to health. Chronic stress and poor sleep can negatively impact immune function and overall well-being. Tips for better sleep and stress reduction. Establish a routine. Maintain consistent sleep and wake times to regulate your body's internal clock. Create a restful environment. Ensure your bedroom is quiet, dark, and cool. Limit exposure to screens before bedtime. Practice relaxation techniques. Incorporate activities such as yoga, meditation, or deep breathing exercises to manage stress effectively. Conclusion. While a Gleason 4+3 prostate cancer diagnosis is serious, integrating healthy dietary choices, regular physical activity, and proper sleep can empower you to influence your health positively. Always consult with your healthcare provider before making significant lifestyle changes to ensure they align with your overall treatment plan. If you've made it this far, that means one thing. You're serious about taking control of your health. And let me tell you, that already puts you ahead of 90% of men who get a 4+3 diagnosis. You now understand what most people never do, that a 4+3 diagnosis isn't the end, it's a turning point. And now you know how to navigate it with confidence. But here's the deal. I don't want this to just be a one-way conversation. I want to hear from you. What's your biggest fear about prostate cancer? What's the one thing you learned today that surprised you the most? Drop your thoughts in the comments below. I personally read every single one. And if this video gave you clarity, hit that like button, because when you do, YouTube pushes this video to more men who desperately need this information. And if you know someone, a friend, a father, a brother, who needs to hear this, share this video with them. It could literally change their life.